the SLTV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please make sure you like, share, and subscribe. See you soon.
Today, we're tackling a really important topic: malaria during pregnancy. Now, this is a preventable and treatable disease, but it still poses a huge threat to pregnant women and their unborn babies all over the world. Understanding how to fight it is absolutely crucial, so let's jump right in. Take a look at this number, 10,000. It's a really tough number to swallow, but that's the estimated number of mothers who die from malaria during pregnancy every single year. It's a staggering figure, and it shows you why getting this right is, quite literally, a matter of life and death. So you might be asking, why are pregnant women so vulnerable? Well, the answer is actually in the body's own defense system. You see, pregnancy naturally lowers a woman's immune response. This makes her way more susceptible to getting malaria and developing a really severe illness, especially if she's living in a high-risk area like sub-Saharan Africa. This quote right here, it gets straight to the heart of the problem. A malaria infection isn't just about one life, it directly puts two lives in danger. And it's this dual threat that makes understanding the risks and the right treatments so incredibly important. Okay, so what are those dangers exactly? When malaria goes untreated, it can kick off a whole cascade of devastating problems for both the mom-to-be and her developing baby. Let's break down exactly what's at stake. So you can see the risks are incredibly serious, and they're all connected. For the mother, we're talking about severe illness, anemia, and even death. And for the baby, the consequences are just as dire. Low birth weight, a much higher risk of miscarriage or stillbirth, and being born too early. It makes one thing crystal clear, right? Protecting the mother is the only way you can protect the child. Now, before a single pill is taken, there is one absolutely non-negotiable first step. You have to confirm the diagnosis. A rapid test or looking at a blood sample under a microscope has to be done to be sure it's malaria. This is all about making sure the right medication is given for the right reason. And that brings us to the core of it all, treatment. It's not as simple as just grabbing any antimalarial drug off the shelf. The safety and effectiveness of these medicines can actually change depending on which trimester you're in. That's why following the World Health Organization's guidelines is absolutely essential. So what does a safe treatment plan look like? Let's make it simple. For uncomplicated cases, the go-to is a drug combo called artemether-lumefantrine. And the great news is it's recommended for the entire pregnancy. For severe malaria, where things are more dangerous, the approach is even more direct. Intravenous arsenate that goes right into the bloodstream to work fast. And it's the standard of care in every single trimester. The key takeaway here is just this: there are proven, safe, and effective options available. Okay, treatment is our lifeline when infection happens. But you know what's even better? Prevention. It's our first and best line of defense. The WHO recommends this really powerful three-pronged approach to shield pregnant women from malaria in the first place. Let's see how it works. Think of these three pillars as working together like a complete shield. First, there's preventative therapy, using a safe drug to stop an infection before it starts. Second, sleeping under an insecticide-treated mosquito net every single night. That's your physical barrier. And third, prompt case management, which really just means getting tested and treated the moment you feel sick. Together, they close any gaps and just dramatically reduce the risk. Knowing all this stuff, the treatments, the prevention, that's only half the battle. The other half is knowing when to act. Being able to spot the warning signs and getting help immediately. That is the most crucial part of the whole plan. Okay, pay really close attention to these red flags. A fever that just won't go away. A really bad headache, vomiting, weakness, any trouble breathing, or convulsions. If you're pregnant and you experience any of these, especially if you're in a place where malaria is common, do not wait. See a doctor right away. So, we've covered a lot of ground. The risks, the treatments, how to prevent it. But if you're going to walk away with one thing, what is the single most important idea to remember? Well, it all boils down to this. This is it. Delay is dangerous. In the fight against malaria and pregnancy, time is everything. Every single hour matters. Getting diagnosed quickly and getting on the correct treatment, that's the key to a healthy outcome for both mom and baby. Seeking help immediately isn't just a good idea, it's a lifeline.
Please subscribe.